access does significantly benefit patients, and I think there's several ways in which it does that.
Patients' direct access means that they have more easy access to a range of dental professionals, whereas beforehand they would have had to have come through the dentist and then be referred to a dental hygienist or a therapist. It means that now for periodontal treatment and even for restorative work through a dental therapist, anything that is within the scope of a hygienist or therapist, patients can now access us directly, and then we can choose to refer on to the relevant professional as well if they need to see someone else. So what that means is for patients, they're having increased access to screening, things like oral cancer, caries, periodontal disease, and then they can be referred on, whereas beforehand it was just the one group of professionals, the dentist, that could do that. And now we have hygienists and therapists also offering that to patients. So I think it's only been a good thing for patients that it's been around for the last 10 years.
Getting access to care, there's a lot in the media about sort of a shortage of dentists perhaps, which people are struggling to get in to see.
Where we sit currently, the main issue is the hope would be if you can expand the workforce, you'll actually expand access. That there are certain patients that can be seen by other team members without any worries whatsoever, and considering that they can stay within scope, the ability for people to access care is absolutely key, and we've seen that over the last few years, especially sort of post-pandemic, that access has been a real issue.
So for many years now, if you go to see your doctor, the general medical practice, you don't necessarily need to see the doctor themselves. They've got a whole team of therapists, nurses that can look after you depending on what your needs are. And if something is required, where a doctor's involvement is necessary, well, they can do that. Unfortunately, in dental practice, we just haven't caught up with that. And so we should see an acceleration towards that same kind of delivery.
It's really about being able to provide the treatment and the care that is required for that particular patient, without, like I said before, the need of a prescription or having to see the dentist first. So it gives that patient the access they need to see a professional, a healthcare professional, directly as their first point of contact.
For the patients as well, the fact that you are seeing someone that has limited scope, actually you might be seeing someone that is quite skilled and proficient at those particular things that they do. So actually it is the ability to see someone that is skilled in that particular aspect.
For the patients, they get to see the right person at the right time. So it means they're not seeing a dentist for a checkup and then have to come for another appointment to see the hygienist for their perio treatment or a therapist for their restorative treatment. So again, it makes it much smoother and much more efficient.
Patients accessing clinical dental technicians that are working in dental practice as part of a multidisciplinary team. That's important. They're getting to see someone who has expertise in removable pros and provides, someone who does dentures only, by definition, should be very good at doing it. So a patient's going to benefit from seeing someone who's making lots of dentures, and therefore they have proficiency in that.
We think in the wider aspect as well, you think about sustainability. That means that there's one appointment, not two. There's less travel to and from the practice. There's less disposable materials being used. So it has an impact in that way as well.
Also is an opportunity for cost-effective for preventative treatments, and also it allows for increased convenience and choice amongst patients. So when we think about cost effectiveness, obviously if we're focusing on prevention, which is predominantly the work that I carry out with hygiene prophylaxis treatments, if patients are coming routinely for those treatments and appointments, therefore the idea would be long term, we're going to be saving them money by not having to have extensive, destructive treatments later down the line.
A lot of patients don't like the dentist but they see the hygienist particularly as being a bit more friendly sometimes.
The important thing for a patient, I think, for our patients, is to ensure that we get as many people as possible visiting a dental professional. And we know patients have some reluctance on occasion to get to a dental practice, either because of historical reasons or because of family reasons, where they've had someone in the family's had a poor experience at a dental practice, and patients often come in and say they're never terribly keen on visiting a dentist, or that, you know, they don't like visiting a dentist. It's quite a nice position to be able to say to a patient, you know, please don't worry, I'm not a dentist. The important thing is that you see someone, and for them to see someone who's a dental professional, whether that be any member of the dental team, that's important. As long as we can get patients into seeing someone and provide them with some sort of dental oral health check or care, that's important. So it is important for patients to be able to direct access all members of the dental team. If a patient can directly access CDT, they're more likely to get the care they need rather than avoiding it altogether. And also for CDTs who run their own clinics, direct access provides a good opportunity to offer a personalised, patient-centred experience, and patients can come directly to them with their denture needs. And if further dental treatment's needed, the CDT, of course, will refer to a trusted dentist colleague just down the road, for example. And that means patients aren't necessarily unnecessarily bouncing back and forth between different practices. So there's quite a few benefits. And if a patient's referred to a CDT by their dentist for specific work, they continue their care with the CDT. It reduces the need for repeated visits, and it makes it very much easier for the patient, gives them a good journey to oral health, and makes it a little more straightforward for them.
And there's also a large number of the population who are worried, you know, about seeing dentists. They have this fear, but somehow going to see somebody just to get their teeth cleaned doesn't seem quite so scary. So it can be sort of a gateway to treatment. I've certainly found that with my patients, that it is a gateway for them. It's something that seems a little bit more tolerable, perhaps. So they will get their teeth cleaned if they've got any problems, and if they're seeing a dental therapist, if they've got any, you know, small fillings that need doing, they can get that done. And also, more importantly, the preventive side of things, they can get all the preventive advice to help them take care of their mouth themselves, and it'll be tailored to that individual. So, yeah, I think that's a real benefit to patients to be able to access these people that way.
But also it's increasing oral health screening for patients, because therapists and hygienists are trained in screening for oral cancer. So if you're getting people coming into your chair, then you're screening far more people than if you're just waiting for people that have got access to a dentist. Cuts down waiting lists, that sort of thing.
Well, I suppose one of the disadvantages might be that if they're not seeing a dentist and they're not taking the referral from us to go back to see their GDP, to have checkups and whatever done, then that could be a problem in that, you know, they're not getting the treatment they may need. Some people might rely on going to see a hygienist or therapist because it's quicker, maybe it's easier, it's probably a bit cheaper as well, and they can do an awful lot of that cosmetic clean that they want quite regularly. So, you know, they may not want to go and have the further treatments that they need. But in my experience, I haven't come across that. In my experience, it's been totally the opposite, where it's been that they've taken it on board. Anything you've said, any recommendations, they've asked for advice on further treatments. So you have been able to upsell if needed, you know. So I think that really, to be fair, the chances of that happening are very slim. Especially in the hands of a capable clinician. They're not going to let somebody, they're not going to have supervised neglect, you know. They're going to make sure a patient is referred where it needs to be.
Particularly with NHS direct access, hopefully it's making a little bit of an impact on the waiting list. But it's really important to recognise that for an awful lot of patients that want NHS care, that haven't seen anybody for a very long time, they're actually not going to be suitable for a therapist to treat, because they're going to have far more advanced problems than is within our scope of practice.
So the impact it's had, I think, has been incredibly positive for patients. They get what they want, which is to see somebody without having to jump through the hoops first. And also the positive effect it's had on our profession, where it has now started to, develop it and let it be recognised for the profession that it is, as opposed to a profession that has to be told what to do.